Voyeuristic disorder represents a complex psychological condition classified within the spectrum of paraphilic disorders in contemporary psychiatric literature. This condition fundamentally involves persistent patterns of sexual arousal derived from observing unsuspecting individuals who are undressing, naked, or engaging in intimate activities. The disorder extends beyond mere curiosity or fleeting inappropriate thoughts, manifesting as a compulsive behavioral pattern that significantly impacts both the individual experiencing it and potential victims. The clinical definition of voyeuristic disorder requires several specific criteria to be met according to established diagnostic frameworks. The individual must experience recurrent and intense sexual arousal from observing unsuspecting persons for at least 6 months. This arousal pattern must be accompanied by either acting upon these urges with non-consenting individuals or experiencing clinically significant distress or impairment in social, occupational, or other important areas of functioning. The distinction between occasional inappropriate thoughts and a diagnosable disorder lies in the persistence, intensity, and functional impact of these behaviors. Understanding the etiology of voyeuristic disorder requires examining multiple contributing factors that interact in complex ways. Biological predispositions may include neurochemical imbalances affecting impulse control and sexual behavior regulation. Psychological factors often involve early developmental experiences, trauma history, attachment difficulties, and maladaptive coping mechanisms. Social and cultural influences contribute through exposure to inappropriate sexual content, distorted relationship models, and societal attitudes toward privacy and consent. The interplay between these biological, psychological, and social factors creates unique presentations for each individual affected by this condition. The behavioral manifestations of voyeuristic disorder typically involve elaborate planning and execution of observational activities. Individuals may engage in window peeping, hidden camera placement, or strategic positioning to observe others without consent. These behaviors often escalate over time, becoming increasingly risky and invasive. The compulsive nature of the disorder means that individuals frequently continue these behaviors despite awareness of legal consequences and potential harm to others. The secretive nature of these activities often leads to social isolation and increased shame, creating a cycle that reinforces the problematic behavior. Treatment approaches for voyeuristic disorder typically involve comprehensive therapeutic interventions addressing multiple aspects of the condition. Cognitive behavioral therapy serves as a primary treatment modality, helping individuals identify triggering situations, develop healthy coping strategies, and modify distorted thought patterns. Acceptance and commitment therapy may help individuals manage urges while aligning their behavior with personal values. Group therapy provides opportunities for peer support and accountability within a controlled therapeutic environment. Medication may be considered in cases where underlying mental health conditions or impulse control issues require pharmacological intervention. The legal and ethical implications of voyeuristic disorder extend far beyond individual treatment considerations. Voyeuristic behaviors constitute serious violations of privacy and consent, often resulting in criminal charges including stalking, harassment, or invasion of privacy. The psychological impact on victims can be profound, leading to feelings of violation, anxiety, and mistrust. Society's response to these behaviors reflects broader values regarding personal privacy, consent, and sexual autonomy. Legal frameworks continue evolving to address technological advances that create new opportunities for voyeuristic behavior. Prevention strategies for voyeuristic disorder focus on early identification and intervention before behaviors become entrenched. Educational programs addressing healthy sexuality, consent, and respect for others' privacy serve as primary prevention tools. Mental health professionals play crucial roles in recognizing early warning signs and providing appropriate referrals. Community awareness initiatives help create environments where inappropriate behaviors are quickly identified and addressed. Supporting individuals who recognize problematic urges before acting on them represents a critical component of prevention efforts. The prognosis for individuals with voyeuristic disorder varies significantly depending on multiple factors, including motivation for treatment, severity of symptoms, and presence of co-occurring conditions. Successful treatment outcomes typically require sustained therapeutic engagement, development of healthy coping mechanisms, and ongoing support systems. Relapse prevention strategies must address triggering situations, stress management, and maintenance of therapeutic gains. Long-term recovery often involves fundamental changes in thinking patterns, behavioral responses, and lifestyle choices. Research continues advancing our understanding of voyeuristic disorder through neuroimaging studies, treatment outcome research, and epidemiological investigations. Current studies examine the effectiveness of various therapeutic interventions, the role of technology in both facilitating and treating the disorder, and the development of specialized assessment tools. Future research directions include exploring the relationship between voyeuristic disorder and other mental health conditions, investigating the impact of societal changes on prevalence rates, and developing innovative treatment approaches. The complexity of voyeuristic disorder requires comprehensive, multidisciplinary approaches that prioritize both individual treatment needs and societal protection. Mental health professionals, legal systems, and communities must collaborate to address this challenging condition effectively. Understanding voyeuristic disorder as a treatable mental health condition rather than simply criminal behavior opens pathways for intervention and recovery while maintaining appropriate accountability for harmful actions. This balanced approach offers hope for individuals struggling with these impulses while protecting potential victims and upholding societal values regarding privacy and consent.